Hi, good evening to everyone. Thank you for joining me. Today, I'm sharing with you a vision of the future. I'm test running, literally beta testing an idea that I've been given just less than an hour ago. So, this has been quite exciting for me. I am now putting together what I think could be quite valuable, a health and wellness network. You can join me in this journey because I've realized over the past few years I really enjoy sharing health information. I like putting it together. I like trying to come up with ways to make it coherent so that anyone can understand it. And critically, I have enjoyed even putting together some of the slides that I've done over the period of time. So, just to give you an example, I've got here, this is now my slide compilation just from my Advanced 360 course. These are all the slides I have done with regards to COVID, and it hasn't included the last two courses that I've done. And I've tried to explain things from all kinds of angles to try and see if it can make sense to people about COVID, autoimmunity, heart disease, anything that I think is relevant with regards to COVID. So we're talking about over 200 slides that I have already put together. And now the challenge is it's not that COVID has gone away, but I feel almost that I have put all the information together with regards to the COVID advanced course. That's like eight, nine modules and almost, 60 modules, eight parts. And I feel almost that that work is almost complete. And it's now about taking apart many other health conditions. And critically, one of the points that I highlight to people is that the future needs to take into consideration, especially from a health and medical point of view, needs to take into consideration this storm, spike triggered autoimmune response mechanism. Listen, it is a concept that I have coined, and I've put it that way largely because I need people to grasp the significance of it. And I don't mind it being challenged because what it means is that the scientific community is thinking about it. So we have a lot of challenges in front of us. And so what I'll be doing today, quite spontaneously, and I do appreciate the people who are with me today. Normally, I don't necessarily interact as much with regards to the comments because I'm just focused on actually getting the information across. And so I appreciate the people who are here with me. And what you can do is that I want you can ask me questions now and I'll try and use the information that I have to put it together. But most importantly, what I want you to do is I want you to fill out the form in the link. I've only got one link in the description. And this one link here is just about the Health and Wellness Network. And in it, we need your name, last name, email address, and then what is your main health concern. And then there's an area down here, which is what would you like us to focus on? And my view is that this is the beginning of a journey taking apart health and wellness questions that you may not have been able to get answers to. And I find it challenging to be able to try and take those things together and put it together, try and answer whatever it is that you may need to be answered. So, starting off quite spontaneously, if you have a question, you can ask me if you're live. If not, please just click on the link and fill out that form and put in what you would want us to focus on. We're building a community here and a network to try and get answers. Important for you to know that when you sign up, you are also subscribing to our newsletter. And I'm telling you that this is getting better and better each time. It has all kinds of information in it, going all the way back, fascinating images, great articles. And a lot of them are unique articles that we have put together in collaboration with Lumientia. And so it's really been a work of art almost to try and put it together in the way that we have got it. And one of the things that I feel quite proud of is the fact that it didn't have anything to do with me. I'll try and see if I can show you this here. is that we've even got audio connected with it here. So this is what it would look like. This is the newsletter. This is how it looks. And this is what it would look like coming in your email. And it has all the stories and all the things. And now we've just added to it. Listen to this.
A message from Dr. McMillan. Staying ahead of the science is challenging, but essential in this COVID-19 pandemic. Breakthrough research, expert interviews, and exclusive commentary from Dale, COVID-19. Advanced 360 course COVID-19. Advanced 360 course.
Isn't that remarkable? I mean, this is great stuff. So, yes, we want you to join in. This is a brilliant newsletter. And this week in the newsletter, we have focused on, as I've mentioned before, the storm, spike triggered autoimmune response mechanism. And I've collated or correlated it with regards to what was happening earlier in the pandemic with, say, Dr. Shetty. And here you have this is the story almost, and you probably can't see this fully. Let me just switch over here. um, this here is showing the story from Dr. Shetty and talking about his journey and his observations. And additionally, we looked at his eighth day protocol, what had happened, and how he had done it. Not in detail, but just the story of it. And then I went on to look at Storm, the presentation from infection to the immune response as to what I think is happening here. So this is a unique article that you can only get in terms of the in terms of our presentation and joining us on the newsletter. So yes, it is quite a challenging thing, but let me just quickly see if we have any points here. Has Gert done any updates? I think he's still on his live thing, and I hope to plan to speak to him again soon. And somebody here, if possible, I'd like to learn more about the brain damage as well as the smell and hearing problems related to COVID 19. You know, hearing is a very good one, SW. People keep on talking about it. It's not something I've actually focused on in any great detail as yet. Um, and I would be thinking about how I'd approach it is that everything is about understanding which proteins are primarily targeted in terms of COVID. And I would look therefore for ACE2 in terms of the hearing mechanisms, in terms of many of the neurons associated with it, as well as neuropilin 1. If these are involved in hearing in a significant way, because I anticipate that when people are exposed, they can have triggering of autoimmune responses, especially to ACE2, that's what I would think could be the mechanism that could be happening as well. Um, Part of the science which is not being addressed is all of the phenomena of a wireless electronic network of addresses present in most of the COVID vaccinated visible on Bluetooth. You know, I truthfully I haven't done much research on that, and I genuinely don't know if that is purely conspiratorial or whether or not that is closely linked to the science. I what I've learned so far in the pandemic is I don't ignore anything. And so if people are observing things, if I can find evidence of it, I will then look into it. And so I've heard a lot of discussion about 5G, and I genuinely don't have enough science around whether or not it's causing direct health problems. But I think that anytime we do something new, anytime there's a new technology, it's always reasonable to ask. I don't see any problems with people asking the questions, but it's whether or not we can get to the answers of it. Clara says another virologist showed how Gert is right on YouTube. I think I agree with them. I think Gert has been right from the start. And essentially, what he has predicted is happening now. You know, one of the funny things about what Gert has predicted, and this is now, I'm going to tie this to what I have spoken about in the past with regards to Storm. Now, a slight difference in terms of my thinking is that I also anticipate that this variant is going to come along and cause a lot of problems. However, based on what I'm seeing clinically, my anticipation is that it is not going to present in the same way that we had severe disease in the past. It's a really important differentiation in terms of what it is that we are seeing now, because here is I take people back to an important slide, and I'll get this slide up so that you remember or understand what it is about COVID that caused severe disease in the first place. If you grasp this, you'll understand why it is that I say that it can't present in the same way again when we look at where we are now. So I'll try and see if I can get this up in just a second. And this image here, let me just show you what it looks like. So this image here is about the interferon response to SARS-CoV-2. And what they found in mice is that in 2016, so this work was done on dysregulated type 1 interferon and inflammatory monocyte macrophage responses in mice at the time. But this mirrors what we've seen in COVID, is that you don't get severe disease if you have an early interferon response. And you don't get severe disease if you have no interferon response. So this is very important. So people who even were immune suppressed would have had different presentations. They may have had other viral symptoms, but they wouldn't have had severe respiratory COVID disease with the cytokine storm. However, if you had a strong immune response that was delayed, you would then have severe disease. And you can see the green represents the SARS-CoV-2 titer. And that was because it literally caused the immune system to overreact if you had a delayed interferon response. And so when we think about where we are today, the world either has you either have natural immunity or hybrid immunity. There is no other thing that you've got. So what it means is that everybody has some kind of immunity, which would therefore make it difficult for the issue with regards to what is happening about a severe disease that could be occurring to happen. And so that's an important one that we really have to try and look at. Um, Let me just let's just see. I'm just checking something here. Um, yes. So and going on in terms of any other questions here. Um, New Zealand recently stated they were passing a law for forced vaccination. That's absolutely scary. I don't know if you know why they would do that. Here is Paul. One molecule overlooked is melatonin. I agree. You know, here's an important point, and this is why I think that people need to remember the characteristics with regards to what is happening, is that any kind of antioxidant will impact on some of the issues around storm and even severe COVID 19. And it's because anything that helps to protect the body from an immune overreaction is going to be beneficial. Um, as somebody says, niacin and nicotine patch to get my brain back. So disturbing. Certainly, we've spoken recently about the nicotine patch. That's something that is there. Thank you, Edgar. Appreciated. VGCC seriously affected and generational exposure weakened cells co-factoring with fact. I'm not sure what that is genuinely, and so I don't know how to answer that. Um, I'm just looking through here just to see if there are any other main points. Thank you, Michael. Really appreciate the input. And when is the next pandemic? You know, this is an interesting one, Paddy, because I think that the next pandemic is already here. Actually, let me rephrase it. It is not a pandemic. it is a regional epidemic because there are parts of the world that are not being affected. And the problem is COVID. If you think about the Olympics, Lyles just recently ran the 200 meters. He had COVID. What it means is that COVID is spreading right throughout the Olympic Village. It means that it's spreading most likely in among the people who are working in the Olympics. And so we are likely to be having a super spreader event occurring in France. The problem is that everybody underestimates COVID simply because the initial symptoms these days are relatively mild. Remember, this is doing some pretty significant damage with regards to what's occurring in your immune cells. And so it shouldn't be underestimated as to what is happening. It's taking out CD8 cells, CD4 cells, critically, the natural killer cells. And this is what I've predicted is part of the reason why we are getting such issues at the moment with regards to macrophage activation. So pretty serious times ahead of us, and I expect this to continue. So I don't think this is going away. Just in case you joined us late, I want to remind you that we have here a form, and this is so if you have specific questions that you want to be answered or areas to be covered, please put it in this form. You'll be joining our newsletter network as well, and you'll be able to interact with what we want to do in the future. I really want to try and see if it's possible to build a network where we're sharing ideas and bringing concepts together, and I can build out the information for what is happening. I'll take a couple more points before we have to go. Consider autophagy and carb restriction for the brain fog measure improvement. I think he was referring to somebody. You know, this issue with regards to autophagy and fasting especially, I have now come to the conclusion that many of the things that people think are primarily religious actions, so say for instance, meditation is very good for mental health. We have here the chanting and deep breathing, good for health. Fasting, although it's primarily a religious activity, is also very good for health. And so many of these things that we think are just routine problems, I think are critical issues that can help to build health. And fasting is one of those that allows the body to rebuild in time. Um, are there nitric oxide nasal sprays that can be purchased, and where can you buy them from? You can buy nitric oxide nasal sprays. I'm sure you can find it on Amazon. What I usually say to people is actually quite simple in terms of what I think needs to be done. When you think of nitric oxide, um, all I say is that nitric oxide has multiple effects. It's not it's good, but you have to be careful in terms of the how much you use. And so my advice is that this is why I like humming, or this is why I focused on humming, because your sinuses are a reservoir for nitric oxide. So when your body needs it, it can take it. And by humming, you just literally build up the reservoir. And that's what I think is really, really beneficial for people to understand. So even though you can have benefit with regards to taking nitric oxide separately, I think that on balance, this is something that if you just hum normal diet, build it up in the sinuses, this is what it would look like, especially in the sphenoid sinus, because that will help to protect the brain. The nitric oxide is specifically used in brain tissue, especially myelin. It also is anti inflammatory. So just by humming and filling these areas in the head with nitric oxide, you are going to be protecting your body and your health. So these are just some pretty simple ideas that I said over time I think are very, very beneficial. So as we close out, I'd like to remind you all again, please remember, we want you to join our network. I want you to join here. The link is here. It's the only link in the description. I want you to share what you're interested in. and we'll start building out a network where we will be answering and raising the points about them. If it's not any of the main things, you can put any other specific free text in this region here and join us in this journey. So, really appreciate you being with us now. And as usual, have a great evening, and we look forward to bringing you more valuable information in the near future.